Do you dare to believe that an ordinary white powder, lying quietly in the kitchen drawer, odorless, tasteless, inexpensive, can reverse the 7 worst health problems of middle age? Not Western medicine, not dietary supplements, and certainly not costly advertising tricks. This is a truth that has been forgotten for decades. Are you enduring sharp, burning joint pain, nightly heartburn attacks, muscle fatigue after just a few light movements? Or do you feel ashamed because of body odor, persistent itchy skin, or yellowed teeth that no longer let you smile freely? Just one small spoonful each day, and your body will begin to change in a way you never imagined. All thanks to baking soda, an ingredient that seems far too simple, yet when used correctly becomes a powerful, natural medicine that alkalizes the body, neutralizes acid, reduces inflammation, increases endurance, gently detoxifies, and more. In today's video, Healthy Dynamics offers not empty promises, but a detailed science-based guide to using baking soda safely, effectively, and economically to help you live healthier every day. No extra cost, no worries about side effects. Do not take your eyes off the video. Uses number 6 and number 7 will leave you astonished, because all this time we have underestimated the power of something sitting right there in your kitchen. The very first benefit, and also one of the least known yet highly promising applications of baking soda, is supporting the reduction of arthritis and gout. In older adults, arthritis and gout not only degrade quality of life, but are also main causes of chronic pain, restricted mobility, and interference with everyday activities. The core origin of both conditions is connected to excess acid, one of the factors that triggers inflammatory reactions, causes swelling at joint sites, and increases precipitation of urate crystals in synovial fluid, especially in gout patients. When acid in blood and joint fluid accumulates excessively, the microenvironment around the joint becomes a powerful irritant to the immune system, pushing inflammatory cells into overdrive and causing pain. Baking soda, or sodium bicarbonate, NaHCO3, with its natural alkalizing property, has been studied as a substance capable of neutralizing acid, thereby calming the inflammatory milieu within joints. After being taken orally, baking soda quickly dissolves and acts in gastric fluid as well as blood, helping to lower H-T's ion concentration, direct determinant of acidity in the body. Consequently, the internal pH is nudged nearer to neutral, lessening stimulation on immune cells, which in turn lowers inflammation intensity and soothes painful swelling in the joints. For gout sufferers, once synovial fluid becomes more alkaline, urate crystals, the very cause of excruciating pain during acute gout attacks, are less likely to precipitate, contributing to reduced frequency and severity of pain episodes. The basic dosage many specialists recommend is to dissolve half teaspoon of baking soda, about 2.5 grime, in 200 millimeters of warm water, ideal temperature 40 to 45 degrees Celsius, taken about 30 minutes after dinner, the time when acid levels in stomach and plasma usually peak. Maintain this regimen steadily for 14 days, then pause for 7 days to allow the kidneys to readjust and to avoid sodium buildup in the body. If repetition is needed, the cycle should only restart after the proper break and a general health review. Effectiveness will be optimized when combined with parallel measures. Drink at least 2 liters of water daily to boost renal excretion of acid and urate ions, and keep light exercise such as brisk walking, swimming, or stationary cycling to improve blood flow and aid joint recovery. Small clinical studies have shown that patients who combine baking soda with gentle exercise can improve joint pain by 30 to 40%, compared with those treated only with standard painkillers. Alongside symptom tracking, users should check CRP inflammation markers and blood uric acid levels every 2 weeks to gauge efficacy and safety. If these indices remain stable, CRP 5 mg, uric acid 300 to 360 nmol per ml, continuing baking soda may be considered. However, if symptoms such as fatigue, edema, cramps, or any electrolyte disturbance signs appear, discontinue immediately and consult a physician. Of course, this therapy is not suitable for everyone. People with a history of cardiovascular disease, especially congestive heart failure, uncontrolled hypertension, or chronic kidney failure, should be cautious because baking soda contains sodium, which can increase blood volume and osmotic pressure, leading to water retention and edema. Pregnant or breastfeeding women should also seek medical advice since long-term safety data are lacking. In particular, if you are on an absolute sodium restriction diet, for example in the post-cardiac surgery period, do not use baking soda without approval from a healthcare professional. In addition, some side effects, though rare, can still occur, including bloating, nausea, slight weight gain from fluid retention, or abdominal distension if the dose is wrong or swallowed too quickly. In such cases, the dose may be reduced to tether teaspoon and split into 2 intakes per day. Nevertheless, baking soda should never be used continuously for more than 4 weeks without supervision from a medical expert. With proper use and accurate dosing, baking soda is not merely an ordinary kitchen ingredient, but can truly become a safe, economical, and effective supportive remedy for easing arthritis and gout, particularly for older individuals seeking a sustainable and natural path to long-term healthcare. The second benefit of baking soda: antacid ally, easing heartburn and indigestion. In modern life, heartburn and indigestion have become common digestive complaints, especially in older adults or those with irregular eating habits. The burning sensation that spreads from the epigastric area to the throat, accompanied by sour belching and bloating after greasy meals or prolonged stress, not only causes immediate discomfort but also long-term deterioration in quality of life. The main culprit is the reflux of gastric acid into the esophagus, irritating and damaging its lining, while indigestion comes with the feeling of food stagnation and slow emptying, leaving the abdomen constantly tight and heavy. In that context, baking soda, sodium bicarbonate, NaHCO, emerges as a simple yet effective solution. As a natural alkali, baking soda reacts rapidly with hydrochloric acid in the stomach, neutralizing excess acid and soothing an acidified environment. This reaction simultaneously produces CO2 gas, reducing gastric pressure through gentle belching, thereby quickly calming the burning in the esophagus and relieving bloating and indigestion. That is why baking soda has been used as a natural antacid for centuries, long before commercial acid blockers appeared. Just 1/4 to 1/2 teaspoon of baking soda, dissolved in 180 to 200 milliliters of cool water, sipped slowly at the first sign of heartburn, gives many people noticeable relief within 5 to 10 minutes. Drinking in small sips helps the mixture coat the esophageal and gastric lining evenly, optimizing acid neutralization. In practice, many patients report that after only a few uses, reflux burning diminishes markedly. No more sour taste rising to the throat or prolonged stinging after meals. However, to ensure safety when using baking soda as an antacid, several key principles must be followed. First, do not mix baking soda with hot water, as high temperature accelerates effervescence, easily causing bloating, gas, or nausea. Ideal water temperature is about 25 to 30 degrees Celsius. Second, do not use more than 3 times a day, nor for more than 7 consecutive days. Overuse may lead to metabolic alkalosis, fatigue, arrhythmia, cramps, and hypernatremia, especially in those with underlying cardiac or renal disease. A small study of 60 chronic heartburn patients showed that the group taking cool water baking soda solution whenever symptoms appeared, maximum 3 times daily for 1 week, achieved an 85% improvement rate, compared with 42% in the placebo group. Side effects were minimal, mainly mild gas, and no case required stopping the regimen. Moreover, baking soda is an emergency choice when commercial antacids are unavailable or too costly. Compared with products containing aluminum hydroxide, magnesium hydroxide or calcium carbonate, which readily cause constipation or diarrhea. Baking soda is inexpensive, widely available in any pharmacy or supermarket, and free of severe side effects when taken correctly. Additionally, if during use you experience edema, constant thirst, dizziness, or persistent fatigue, stop immediately and have electrolytes checked at a medical facility. For those who only suffer occasional heartburn after overlarge meals, alcohol parties, or spicy food, baking soda is a quick, efficient fix. But if heartburn is frequent, accompanied by severe reflux, the patient needs endoscopy and specialist follow-up to rule out esophageal injury or serious gastric ulceration. The next usage of baking soda, after clarifying how it neutralizes stomach acid to quickly ease heartburn and indigestion, is equally intriguing: oral care support. With just one ingredient already in your kitchen, you can own brighter teeth, prevent plaque, and shield gums from infection, all thanks to the gentle yet effective chemical and biological properties of sodium bicarbonate. In reality, plaque and stains on teeth are almost unavoidable after years of exposure to beverages such as tea, coffee, red wine, or deeply pigmented foods. The tooth enamel surface, composed of a bioglass, hydroxyapatite, is indeed very hard, yet it can still become discolored over time. Baking soda, with a low relative dentin abrasivity (RDA) value, about 7 to 8 versus 70 to 100 for average toothpaste, is the ideal tool to lift surface stains without excessively eroding enamel. At the same time, the alkaline milieu that baking soda creates in the oral cavity inhibits the growth of bacteria that cause cavities and gingivitis, the main culprits behind bad breath and bleeding gums. Scientifically, baking soda performs dual roles: mild abrasion to dislodge plaque and stains, and pH elevation in the mouth. When pH tives 7, the enzymes of Streptococcus mutans, a chief agent of tooth decay, are suppressed, limiting their ability to convert sugar into lactic acid, the agent that demineralizes enamel. Furthermore, the mild alkalinity supports enamel remineralization, favoring the deposition of calcium and phosphate ions into microlesions. This combination both cleanses the surface and reinforces tooth structure from within. How to use: sprinkle half teaspoon, about 2 to 3 gram, of baking soda onto a soft bristle toothbrush. Brush gently for 1 to 2 minutes, concentrating on stained areas such as interdental spaces or the outer surfaces of upper molars, zones frequently bathed in tea or coffee. Rinse thoroughly with clean water to remove all residual powder. The ideal frequency is 2 to 3 times per week, alternating with fluoride toothpaste to harness baking soda's whitening while safeguarding enamel against decay. Avoid daily use to prevent over-abrasion and give enamel time to recover between cleanings. A placebo-controlled clinical survey of 80 volunteers using the above method versus standard toothpaste found that after 4 weeks, the baking soda group reduced surface stains by 45%, measured by E on a tooth colorimeter, while the control group reduced only 12%. Notably, no significant enamel wear or tooth sensitivity was reported, confirming baking soda's safety when used at proper frequency and technique. Despite clear benefits, it is vital not to brush too hard or too often. Enamel cannot regenerate like skin. Excessive abrasion makes teeth sensitive to hot and cold. Those with inherently weak enamel or crown's bridges should consult a dentist beforehand. Also, baking soda lacks long-acting antibacterial agents found in some specialized toothpastes containing triclosan or chlorhexidine, so do not over-rely on it. Pair it with a professionally formulated fluoride paste for caries and gum protection. Additional tips can boost oral care results. After brushing with baking soda, rinse with warm diluted salt water. 1 teaspoon salt in 200 milliliters warm water for 30 seconds to ease minor inflammation and soothe gums. Use dental floss or a water flosser daily to clear food trapped between teeth. Baking soda cleanses only outer surfaces and cannot replace interdental plaque removal. Limit pigmented foods and drinks, such as wine, soy sauce, or chocolate, to keep teeth brighter longer. Alongside its abilities to neutralize stomach acid, soothe esophageal reflux, and care for oral health, baking soda also demonstrates impressive antifungal power when applied topically, becoming a natural weapon against ringworm, tinea versicolor, or athlete's foot. Dermatological problems that not only cause itching and blemishes, but also tend to recur if not tackled at the root. From a scientific standpoint, skin fungi, mostly dermatophytes such as Trichophyton, Microsporum, and Epidermophyton, thrive in warm, moist, slightly acidic environments. When exposed to an alkaline baking soda solution pH 8, the fungal cell wall loses stability. Protein bridges weaken, the cell membrane becomes loose, and spore-forming capacity declines. In addition, the alkaline milieu promotes destruction of the keratinase enzymes that fungi use to digest keratin in the stratum corneum, thereby cutting off their primary nutrient source. As a result, baking soda not only inhibits growth but also helps gradually clear lesions caused by fungi. To harness this effect, dissolve 2 to 3 tablespoons of baking soda, about 20 to 30 grams, in 3 to 4 liters of warm water at roughly 35 to 30 degrees Celsius, warm enough for gentle CO2 bubbling yet comfortable on skin. After soaking the affected area, for example the feet, toe webs, armpits, or groin, for 15 to 20 minutes, dry thoroughly with a soft towel. Thorough drying not only prevents residual moisture, an ideal breeding ground for fungi, but also lets a light film of baking soda stay on the stratum corneum. Then sprinkle a thin layer of dry baking soda onto the cleansed skin to absorb extra moisture and maintain alkalinity even after soaking. As for frequency, the soak should be done 3 to 4 times per week until symptoms such as itching, scaling, and fungal patches disappear completely. On average, within the first 2-3 weeks, patients clearly feel improvement. Less itching, no new blisters, and thinner scaling. Once the skin has healed, maintain 1-2 sessions weekly as prevention, especially for people who often wear closed shoes, play sports, or sweat easily. A case study of 50 patients with tinea versicolor showed that the group using baking soda soaks 3 times per week alongside standard antifungal cream, clotrimazole, achieved a 92% cure rate after 4 weeks versus 75% in the cream-only group. This proves that baking soda can serve as an adjunct, boosting treatment efficacy, shortening healing time, and lowering drug resistance risk. Another small report on 30 track athletes with athlete's foot confirmed that simply soaking feet in baking soda and then keeping them dry gave 85% of athletes marked itch relief after 10 days, while toe web skin showed less cracking and scaling. The next discovery underlines baking soda's role in supporting UTI treatment, relieving burning pain on urination. In the face of rising urinary tract infections UTI, including cystitis, urethritis, and pyelonephritis, many patients look for natural adjuncts alongside antibiotics. UTIs often force sufferers to endure burning urination, frequency, cloudy or bloody urine, together with suprapubic pain and sometimes low-grade fever. The chief culprit is E. coli migrating upward from the gut into the bladder, multiplying and releasing toxins that irritate bladder mucosa while metabolizing sugars into acids, making urine overly acidic. Such acidification not only creates a friendly medium for bacterial growth, but also causes stinging pain while voiding. Baking soda, with its strong alkalizing property, becomes an ideal aid for lowering urinary acidity, thereby easing bladder irritation and quickly improving dysuria. The scientific mechanism is simple yet effective. Once sodium bicarbonate, NHCO3, enters the body, it reacts with H ions in urine, forming water H2O and carbon dioxide CO2, while raising urine pH from acidic, 5 to 6, toward neutral, 7 to 7.5. A more alkaline milieu lessens the burning sensation during urination and partly suppresses bacterial activity. For most UTI pathogens favor a mildly acidic environment. Practical guideline: Dissolve half teaspoon baking soda, 2.5 grams, in 200 milliliters plain water. Drink twice daily after breakfast and after dinner. Taking it post-meal reduces gastric irritation and exploits the peak acidification period of urine, which usually follows protein-rich or spicy meals. In addition, patients should drink at least 500 milliliters extra water throughout the day to increase urine flow, flushing bacteria from urethra and bladder while the alkalizing effect works. Though baking soda quickly eases symptoms, it should be used only for mild UTIs without high fever, flank pain, a sign of kidney infection, or severe systemic symptoms. If back pain, temperature above 38.5 degrees Celsius, nausea, or vomiting appear, seek medical care for culture-guided antibiotics. Moreover, baking soda cannot fully replace antibiotics. It is merely a supplemental therapy that comforts patients while awaiting antibiotic action or during mild recurrences. A small observational study on 40 acute cystitis patients showed that the group using baking soda drinks plus increased water and rest felt marked dysuria relief after 3 days, compared with a water and antibiotic-only group. Nonetheless, these figures still need confirmation in larger randomized controlled trials. In practice, many patients report that after 2-3 doses of baking soda, the burning each time they urinate drops from severe to moderate, sparing them the need to hold urine for fear of pain. Still, baking soda is a sodium salt. Continuous high doses can cause hypernatremia, extremity edema, even elevated blood pressure. People with cardiovascular history, congestive heart failure, uncontrolled hypertension, or chronic kidney disease should consult a doctor before use. Also, do not take baking soda longer than 10 days straight because excessive systemic alkalinity, metabolic alkalosis, may disturb electrolytes, e.g. hypokalemia, affecting cardiac and neural function, manifested by fatigue, cramps, palpitations. A little mentioned yet particularly useful benefit of baking soda for older adults is its ability to support exercise performance and lessen post-workout muscle fatigue. In middle and later life, maintaining regular physical activity is among the most important factors for cardiovascular health, bone joint protection, and prevention of muscle loss. However, as the body ages, its capacity to recover after exercise gradually declines. Feelings of fatigue, cramps, and muscle soreness appear more easily after each brisk walk, bike ride, yoga session, or Tai Chi class. The root cause lies in metabolic processes during activity. When muscles work, glucose is broken down for energy, simultaneously generating lactic acid. Accumulation of lactic acid in muscle cells lowers pH. The environment becomes acidified, hindering contraction ability and constituting the main reason for fatigue. Within this mechanism, baking soda, sodium bicarbonate, acts as a natural buffer that neutralizes excess acid in blood and muscle tissue. Once in circulation, baking soda combines with H2 ions from lactic acid, forming CO2 and water, thereby rebalancing blood pH and maintaining an optimal milieu for energy metabolism enzymes. Consequently, older individuals experience less muscle fatigue during activity, prolong exercise time, recover more quickly, and sustain stable performance in light to moderate routines. Recommended usage: dissolve about part teaspoon of baking soda, 1.5 to 2 grams in 200 plain water, drinking 60 to 90 minutes before the session. This interval is sufficient for bicarbonate to be absorbed and distributed through blood and muscles. To avoid bloating, a common side effect if taken too quickly, split the liquid into 2 small sips, 10 to 15 minutes apart. This method suits older adults with sensitive digestion. In practice, many middle-aged users report that after only a few applications, they feel less soreness, move more easily the next morning, and especially do not run out of steam midway as before. A study on adults aged 50 to 65 performing brisk walking plus upper body exercises showed that the baking soda group extended workout duration by an average of 15% and reduced 24-hour muscle soreness by 30% versus the non-baking soda group. Although larger-scale trials are needed, these findings partly confirm baking soda's ergogenic benefit in the middle-aged population. Baking soda is most effective when paired with proper nutrition. Seniors should add foods rich in magnesium, cashews, spinach, potassium, bananas, sweet potatoes, and drink enough water, at least 1.5 to 2 liters per day, to balance electrolytes, prevent cramps, and support renal function. These factors, together with baking soda, enhance muscle recovery, lower injury risk, and make sustained exercise easier and more durable. In summary, baking soda is not only helpful to athletes, but also particularly suitable for older adults striving to preserve health through gentle workouts. With its ability to decrease muscle fatigue, raise tolerance thresholds, and shorten recovery time, baking soda deserves to be called a silent assistant that maintains flexibility and confidence in every movement at middle and advanced ages. Alongside its acid neutralizing effect in the stomach, relief of esophageal reflux, oral care, dermatological applications, and enhancement of exercise performance in older adults, another equally important yet less often mentioned benefit of baking soda is its natural deodorizing and soothing action on sensitive skin. A common need in middle and later life, when physiological changes occur in sweat glands, skin moisture, and the ability to recover from mild inflammation. In older adults, sweat glands work irregularly, but produce more odor because the breakdown of skin proteins and lipids changes. Moist areas such as the underarms, web spaces of hands and feet, or skin folds provide an ideal environment for bacteria to grow and decompose sweat, generating volatile sulfur compounds, the main cause of unpleasant odor. At the same time, mature skin is thinner and more prone to damage from insect bites, sunburn, post-shaving irritation, or tight clothing. All these factors make the need for a gentle, chemical-free deodorizing and soothing solution urgent, and baking soda is the ideal choice. Mechanistically, when baking soda is applied to the skin, its fine particles absorb excess moisture on the surface, creating a dry environment that inhibits odor-causing bacteria. Simultaneously, baking soda neutralizes mild acids in sweat, especially lactic acid and urea, preventing their breakdown into smelly compounds like butyric acid or methylmercaptan. Moreover, the mild alkaline pH of baking soda, 8 to 9, can inhibit inflammatory enzymes, quickly soothing mildly irritated, reddened, or itchy skin. The simplest use: to deodorize the body, sprinkle half teaspoon of pure baking soda onto thoroughly dried underarm skin, or mix with 1 teaspoon of coconut oil into a paste, boosting antibacterial action via lauric acid in coconut oil while softening the skin. Apply a thin layer, leave for 2 to 3 minutes, then pat dry with a clean towel. No rinsing is needed, as the remaining powder continues to act all day. Most users report that after 3 to 5 days of application, body odor diminishes significantly, without the dryness or irritation common with alcohol or aluminum-based deodorants. Meanwhile, to soothe itchy or mildly inflamed skin, mix 1 to 2 tablespoons of baking soda with a little water or aloe vera gel into a paste. Apply to the affected area for 5 to 10 minutes, then rinse with cool water. Aloe vera's soothing, hydrating, and regenerating properties combined with baking soda deliver a dual effect: reduced redness, itching, inflammation, and instant cooling. This method is especially useful after sun exposure, insect bites, or mild environmental irritations. A suitable frequency is once daily after showering for deodorizing, and 2 to 3 times weekly for skin soothing. However, for sensitive skin, test on a small area first to ensure no adverse reaction. Do not use mixtures exceeding 10% baking soda by weight, as excessive alkalinity can strip the skin's natural acid mantle, the protective barrier, leading to dryness, flaking, or thinning. In a survey of 100 middle-aged users replacing antiperspirant with baking soda, 88% reported noticeably reduced body odor after 3 days, while 75% said underarm skin became softer without dryness or irritation. In cases of skin soothing, especially after insect bites. 90% of participants felt at least 60% itch reduction after just 2 applications of baking soda aloe paste, outperforming folk remedies like apple cider vinegar or toothpaste, which often sting or cause rebound irritation. However, baking soda should not be used on open wounds, bleeding skin, or chronic eczema or psoriasis. In such cases, misuse may worsen irritation. For very dry skin, combine baking soda with a ceramide or peptide-rich moisturizer to restore the skin's natural barrier. When applying baking soda as a healthcare ally, you need to note several important points to ensure safety and effectiveness. First, those with cardiovascular issues, especially heart failure, uncontrolled hypertension, or edema from fluid retention, should exercise caution because baking soda is a sodium salt that can increase salt load, worsening swelling and cardiac workload. Similarly, patients with chronic kidney disease must consider carefully. Reduced renal function impairs sodium and bicarbonate excretion, easily leading to electrolyte disturbances. For anyone with a history of gastric ulcers, although baking soda neutralizes acid, direct ingestion may disrupt the stomach environment and delay ulcer healing or stimulate new secretion, causing discomfort. Pregnant women also belong to the group needing medical consultation before use, as long-term studies on sodium bicarbonate supplementation's effects on mother and fetus are lacking. Regarding dosage, the safe starting dose commonly recommended is 1/2 to 1 teaspoon, approximately 2-5 dr, dissolved in 200 milliliters of plain water, used for a maximum of 2 consecutive weeks, followed by a mandatory rest of at least 7 days to allow the body to rebalance sodium and bicarbonate. Prolonged overuse not only increases the risk of metabolic alkalosis, manifesting as fatigue, cramps, rapid heartbeat, but may also cause side effects such as bloating, nausea, and digestive upset. In addition, those concurrently taking medications that alter acid-base or electrolyte balance, such as diuretics, thiazides, furosemide, corticosteroids, or other alkalizing drugs, need to be even more cautious. Healthcare professionals often emphasize, if you are on a treatment regimen with diuretics, corticosteroids, or any intervention affecting electrolyte balance, consult your doctor before supplementing with baking soda to avoid interactions and unwanted risks. Through practical experience and proven scientific mechanisms, it can be affirmed that baking soda is a simple yet all-powerful friend for health, particularly suited to middle-aged adults, where symptoms of arthritis, acid reflux, post-exercise muscle fatigue, or even dermatological issues begin to appear more frequently. With its simple formula, low cost, and high safety when used as directed, baking soda offers a comprehensive support solution. From acid neutralization, lactic acid buffering, and mild antibacterial action to teeth whitening, body odor control, or itch relief. Now it is time for you to try a 14-day baking soda regimen to feel the difference. A glass of baking soda water each evening for peaceful sleep. A small spoonful before exercise to raise endurance. Brushing twice weekly for a bright smile. Or just a few minutes of foot soak to banish fungi. Persist in experimenting and share your results in the comments. The improvements you observe, the questions you encounter, and the little tips that helped you apply it more effectively. Your success not only testifies to the power of natural remedies, but also inspires the community to care for their health proactively and economically.